like you to tell us a little bit about your skincare program and the essentials after somebody has invested their time and money into getting youthful appearance with Botox and injections and other things. Let's go with the importance, how you feel about your skincare.
So we think about when we're trying to get healthier on the inside. We might do things like diet and exercise, might get tested and see what nutrients we're deficient in, maybe take some supplements, might modify our eating so that we're healthier on the inside based on our individual needs. And people, forget about their skin. Or they might try different things that may or may not work for them. If we look at, if you went to Target or Ulta and looked at the skincare, it is really confusing. There's a lot of stuff out there. And this has led to the biggest growth in cosmetic medicine, which is physician-dispensed skincare, which is a professional grade, much stronger. And that's it really only comes from a doctor's office because they're gonna have to give you instructions on how to use it. I'm gonna go over that a little bit because they're a little too strong to use without specific instructions. And if you look at, you have 100 things that you could use, what's the most impactful? And there's really four that, everybody should be doing, in my opinion, that have the biggest impact. And you can add on things condition specific after that. Now, one without a doubt is Sunblock that goes on after your skincare. And Sunblock has the ability to slow down aging. And it was an interesting study. I think it was Johnson & Johnson did this, and they published it about 6 or 8 years ago. And they were using a skin elixir to help aging. And they gave people the skin elixir or placebo for 2 months. And they found this special skin elixir had less brown spots, less redness, less capillaries, slightly less wrinkling. And when they unveiled what it was simply sunblock. And we don't think about the exposure we get to ultraviolet light because we call it sunblock. It actually should be ultraviolet light block. I'm standing here in a building that was built in 2000. It's got fluorescent lights that spew out ultraviolet light. You can get a sunburn from ultraviolet light. We did a surgical mission in Peru a few years ago, and they had fluorescent lights that would not be allowed in America, but we all got sunburns and keratitis of our eyes because there was so much so much ultraviolet light giving off by the lights. No, LED lights don't have that, but fluorescent does. So does natural sunlight, so does incandescent lights. We're exposed to that all the time. So we can slow down aging with this sunblock. And that goes on last. So we're gonna just talk about that, and I think you can have your opinion what kind of skincare to use. Typically a mineral-based skincare is what we use, but they also sort of work. So the big three are a vitamin C, and not just a vitamin C, a potent multi-strand vitamin C. So there's many forms of vitamin C. This one has 7 in it. We call it Radiant C. And the vitamin C reduces what's called oxidation, which is really the mother of aging and senescence, something that causes your skin to break down, which is constantly having to fix itself, and eventually your body's ability to fix itself gets impaired. And with vitamin C, we see less redness, more brightness to the skin, less brown spots, better texture to the skin. And then something of what's called a retinoid, or retinol, retinoic acid, or retinaldehyde. We use a tretinool, which is a strong form of vitamin A. So this is a vitamin A, retinol. And the alcohol forms of vitamin A are the most suitable for anti-aging purposes. Very well tolerated. They do cause some drying, but they not as likely to as a acid form, which would be like retin A, a little too strong. And then the glycolic moisturizer. It's called alpha hydroxy acid, the most common anti-aging cream that exists. So these three. So we have a medical grade skincare, a vitamin C that's professional grade that typically might be too strong for some people that have rosacea or a lot of redness. You can start using it 2 or 3 days a week. Retinol. In the case we use a tretinool, which is a little stronger than a standard retinol. That's usually used about twice a week, and then you gradually increase it as tolerated. Some people can use it every day, but most people are using it a few times a week. This gets put on at night. The vitamin C in the morning, the vitamin A at night. Vitamin A again is retinol. And the glycolic moisturizer we use twice a day. If you just do these 3 things for 3 months, your skin will be brighter and more youthful. In our case, if you buy it from us, or it's free. We guarantee it. So more youthful and brighter, or it's free. These are the sure thing. And this is our mainstay for skincare. We have some other things as well. We use this Even Tone Age Defense, which is for somebody that's got melasma or some pigment disorder, and it uses a mixture of things like kojic acid, some anti-inflammatories, and hydroquinone. We've got our own sunblock. We have our eye repair serum, which is a lighter form of vitamin C, vitamin E, and retinol to use around the eyes for dark circles around the eyes or skin crepiness of the eyes. We also have a strong moisturizer used for when people have medical conditions of their skin or they're getting a laser resurfacing done. And one of the biggest mistakes I see in our practice and our providers and in the public is people wanting to do a laser treatment to treat some condition of their skin, and they don't invest in the skincare. You are wasting your money, particularly some treatments like Clear and Brilliant or Fraxel, which is really designed to get medications into your skin. If you're not doing skincare, you're gonna get that stuff back. Come back faster than you wanted to. So don't do the treatments if you're not gonna do the skincare. And one I'm really fond of is called Sirolimus. Some of you might have heard of Rapamycin. It's the same drug. So Sirolimus is a drug, or rapamycin, let's call it rapamycin, is a drug that's being tested for aging slowing down aging in humans as a pill that I take. And it appears to slow down aging of every animal and creature and plant it's been tested on. It's being tested in humans currently. But it has been tested pretty extensively on the skin. And it does slow down, even to some degree, reverse the age of the skin, increases the collagen content of the skin, increases the thickness of the skin, and appears to reduce pore size and improve texture and color of the skin. So Sirolimus is not to be used with a laser. It does impair healing if you have a laser injury. It's something you use 2 or 3 days a week. One bottle will last about 3 months or so. And that comes from a pharmacy. It's got to be prescribed. We can't guarantee Sirolimus because it's a prescription. We get it from a different company. But that's something I like to see people on really of any age. It is used in children for certain conditions, safe at any age. And if I talk about my big 3 plus a Sunblock 4, then Sirolimus might be number 5 as an optional one. Once you're doing these first 3, I wouldn't do Sirolimus without it because it's not preventative, it's more repairing stuff. So I think skincare is something that is maybe, in our practice, we've not been the best at communicating to our customers about and our patients about, particularly when they're doing laser services. And I hear a lot of times people say, well, they just want to do laser and see how it works. Well, if you're doing a laser that's designed to get medications in your skin, you're wasting your money if you don't use the medications. In this case, vitamin C, retinol, and some condition specific